So what would you say your role here is at USC, and how would you describe it on a day-to-day level?
So my role, there's 5 of us in some way, shape, or fashion, and my role in that is to do a combination of mental health and mental performance work. I spend a lot of time in the mental performance side, working with individuals and teams, and I also work with a lot of the injured athletes that are coming back from the mental side of rehab. So that's what I do.
And walk me through your journey that kind of led you to where you are now here at Carolina.
Well, it wasn't straightforward. So probably what was the cause of it was I was a basketball. I played basketball in college, and then I was a basketball coach through my whole career. And then during that coaching, I obtained my master's in counseling, and then worked in college admissions, and then became a college professor, but I kept coaching the whole time, and then I became really interested in the mental part of the game, and so I went back to get my PhD and focused on mental performance and actually on women in sports, and the growth of women in athletics is where my specialty is. And so it was like 4 different careers kind of led me to this one.
Mm-hmm, for sure. And so roughly, how many athletes would you say you work with, like overall or on a day-to-day basis, whichever is easier?
It depends. I usually see anywhere between 10, 15 athletes a week, maybe individually, and maybe an average of 10. And then anytime I work with teams, then you see the whole team. And I try to go to practices and competitions each week.
What sports are you responsible for? Any specific ones?
Not really specific ones, just all sports. I try to get to whatever's in season.
Yeah.
Working, just so they see us. That's one of the goals for this department this past couple of years has been to be more visible at practices and games, so that the athletes know we're here if they need us.
Mm-hmm. And what would you say the most common thing you see, like a theme of what kind of student athletes like deal with or struggle with?
We see a wide variety. I mean, wide variety, but a lot I see is performance anxiety, also transitioning in as a freshman or transitioning out as a senior. See a lot of anxiety overall, time management, time constraints, lack of time, team issues, coach issues, all the way to other mental health issues, that athletes either come with or develop as they, get into adulthood.
Mm-hmm. And I know you kind of touched on like the services you provide. What kinds of services does like the athletic department and like you guys on staff provide for athletes?
So we do. So we have people on staff that specialize. We have people that specialize in substance use. So if we have an athlete that has somebody with a substance issue, then we have somebody that kind of oversees that. We also do team talks for substance reduction and management. We have somebody on staff that specializes in eating disorders and eating issues. We have somebody on staff that specializes with testing, like could be a learning disability or ADHD or any kind of psychological testing that's what they do. If somebody needs to be tested for something, we have somebody that goes there. We have somebody on staff that focuses, on trauma. If somebody comes from a background of trauma or has a trauma. We have somebody that specializes in crisis intervention. If there's a crisis, an accident, or something happens to a team or an individual. So we mental health first aid, educating teams and players about what to do, and if they have somebody that has a mental health issue. We really have a really good background in most everything.
Mm-hmm. And do you think student athletes are ever hesitant to come to you or reach out for help?
Oh, all the time.
And why do you think that is?
That's a question for you.
I know.
I think there's still stigma. I think there's stigma around mental health and having a mental health issue, and I think it's worse. It's a bigger stigma in athletics because we grow up thinking that athletes are perfect, or athletes have everything, or athletes are above all that. When in fact, if you look at statistics, athletes have 50% higher mental health issues than the regular population. So they come with actually more, but we all think if they're an athlete, they got to have everything together. Or they have to be perfect, or they have to have no problems. And I think in athletics, coaches, players, parents, everybody talks about mental toughness. And so if I got to be mentally tough. If I'm not mentally tough, which is not even close to, they think mental toughness is don't tell anybody I have anything wrong. Which I think the mental toughness piece in athletics hurts and makes people hesitant. Because if I come in because I have an issue, then I can't be mentally tough.
Mm-hmm. And what measures do you and the department take to try and reach out to these athletes and let it be known it's okay to use us?
By talking to teams, putting out messages about that. We use word of mouth. Confidentiality I think is really important. Letting people and teams know that it's completely confidential and that you can reach out yourself, and that nobody needs to know. Talking to every freshman that comes in. We go into the sport 101 class. We talk about that, talk about mental health, and we talk about mental performance and how important it is, and how important it is to reach out to us, to have that as part of your growth. So just by getting out there.
Mm-hmm. And what is one piece of advice that you would give to an athlete struggling with mental health?
As I would say that to an athlete or to anybody struggling with mental health, somehow I think they think that it's not going to change, or it's something permanent. And what I always say to people that are struggling with a mental health issue is, how you feel right now is not permanent, because there is help for it. And if you just reach out, you don't have to feel that way, because there is a way to feel better, and it's not something that that you're stuck with, or that's not going to change. It's just, I think the biggest thing is if I was limping because I had a huge splinter in my foot, and it was hurting and it was an issue, what would I do? It's not it will be permanent. You might lose a foot if you leave it in there. but it's not permanent. You could get some help. It's the same thing if you sprained your ankle or broke a bone, or it's mental health issues. Don't have to be permanent. Understanding and figuring out what's going on and then rectifying it.
Yeah.
If more people would know that, I think more people would access it as quickly as they do getting a splinter out. Yeah.
Yeah. Well, cool. That's all I have for you.
That's all you have.